So you are a Republican, and I think people, the comment I hear the most often about you out in the field talking to state employees is, he's a Republican? And the reason they say that is simply, you have fought very hard for a few years here for more people to have access to affordable health care, which is not, which is an issue that's sort of been dominated by one party. And you kind of turned that on its head, and you have fought for the state health plan to get affordable rates, knowing, as you stated, that it would drive the cost of health care for everybody in this state down.
Sure.
So tell us about that. People find that interesting sometimes, that a Republican led that charge for health care.
Well, as a former Congressman John Lewis always said, it's okay to get in good trouble every day. And obviously we've gotten into good trouble as we've tried to drive down the cost and drive up the access to health care in North Carolina. Some of your members have seen this in the past, but 2.5 years ago when I attempted to find out what our state employees are paying for health care, this is the response I got back from UNC Healthcare. Now, by the way, I'm the state treasurer of North Carolina. UNC Healthcare is owned by the taxpayers of North Carolina. So when I sent them a letter trying to get into the weeds of what we're actually supposed to pay, this is what was returned to me. The fact is that this industry deals in secrecy. Their whole business model is secrecy. They don't want anyone to know the cost and the value. So what happens to your members is they get something like this in the mail, an explanation of benefit, and it really doesn't explain the benefit of anything. Facility fee, facility fee, facility fee. Going back to the issue about Republicans and Democrats, it's sad. It seems like the two major parties right now, their whole mission is just to beat the heck out of each other. And we don't attack people at the Treasurer's office, we attack problems. And the problems are, how do we take advantage of our largeness, either the pension, the defined contribution, or the health plan, to drive efficiencies for the benefit of the members? It's that simple. And the other thing I would tell you about the Democrat and Republican is that people across North Carolina are facing the highest levels of job, food, health, and now educational insecurity, the likes of which we've never seen in our lifetime. And they don't really give a darn what political party a person's a member of. They just want their problems solved. And the problems we're trying to solve, especially in healthcare, is how do we drive down the cost? And we have, for example, for our retirees, every year for 4 years, we have lowered the dental premium. Every year for 4 years, we have lowered the vision premium. We just negotiated an amazing contract on behalf of our Medicare Advantage program. We were required to put that out for bid. 0 premium to the member, $4 premium to the dependent, no cost to the state taxpayers. We're going to take all those savings for our Medicare Advantage product and put it toward our unfunded health care liability, which is something that eventually, if it's not solved, will take money away from things that your members care about: public education, public works, public roads, and public safety.
Right. It would literally mean jobs for state employees. So
Correct.
We thank you for that too.